So all of our formulas have very specific suggested use, AM and PM usually, or as needed. But our resilience formula, our antiviral formula or immunity formula that we call it, has a very specific protocol. And what we've done is we've mirrored your protocol for the molecule TML. Can you explain the importance of that suggested use protocol?
Yes, and actually that protocol comes from Dr. Miller from back in the 70s. But the idea is early on with an acute disease, acute infection like you have with COVID or with herpes or flu, you need to give the body several jolts. You can't just give it a good jolt and let it rest because the virus will take over. So we suggest taking a drop every 15 minutes for an hour and then one every hour until a person goes to bed. More importantly, if they start late in the afternoon, for example, you do that, but then do it again the next day because you really don't want to be conservative with the drops in the face of an acute infection. It's also important to say that there are some families of the virus who seem to be more susceptible to the approach of the drops than others. The true flu, like I've mentioned before, certainly are all of the herpes family, and that's really important. We've published about herpes simplex, type 1 and type 2, and Epstein-Barr, and all those. Of interest is the 24-hour flu doesn't care a thing about these drops. The drops don't do anything for that, and we're not always sure why. But it's not a panacea. But for those viruses that do respond, it is important to get multiple hits to get the darn thing under control.
Thank you so much.